Well, the rapid increase in the levels of alcohol and drug abuse in South Africa over the past decade has seen the age of first experimentation with drugs dropping to 10 years and below. Gauteng alone has seen an increasing number of female learners engaging in drug abuse. In a joint operation with the Sophiatown SAPS and the Gauteng Education Department, a raid was conducted at the Westbury High School on Friday morning. Well, for more, we have in studio, that's Clara Monagotla. She's the National Community Developer and Trainer at SANCA. Good afternoon, Clara, and thank you for your time on the PM News Desk.
Good afternoon, Krishni.
Well, substance abuse is skyrocketing on the local front. What kind of substances are being used at our schools right now, Clara?
The most drug of choice is cigarettes, alcohol, which leads to binge drinking, and then we have dagga cases and also nyaope, whereby most of the young people, they start experimenting with cigarettes and then use these other illegal drugs at the end of the time.
But is policing the schools the right answer, Clara? But surely students will just now resort to substance abuse outside the school premises, and it's actually the root causes of the problem that we have to tackle.
Yes, it is quite a serious problem whereby we need our communities to come on board. Also, the role of the parents is very important, whereby they also need to monitor even their children, and also to make sure that the community participate more into the issues of substance abuse, whereby they also need to take ownership of issues such as drug trafficking or drug dealing in their communities.
Clara, but there are some areas that are more high risk than others, can we say? For example, in our poorer communities, where some households may rely on casual work, subsistence, gardening, trading, old age pensions, whatever it is, and this is a very precarious socio-economic context some of our children find themselves in, and it does contribute to some extent to the loss of family structures. How would you go about intervention in these vulnerable communities, shall we say?
This calls for integrated strategy or integrated approach by different service providers, whereby we can look at the wholeness of self, meaning that we have to identify other problems that are affecting the person who is using drugs, so that they can also look into the background, the family structure, and the environment where the person is coming from, so that they can be able to assist this person in all the different areas.
Substance abuse has also been identified as a barrier to education and youth development in the country right now. I mean, some surveys have found that substance abuse is directly linked to high-risk behavior, like unprotected sex, violence and crime. How critical is it for us to create awareness and mobilize communities?
We have to make sure that our young people, they know the dangers of substances, of alcohol and drugs, because one thing for sure, it does, alcohol and drugs, they do affect the person, the growth and development of the young person's brain before the age of 20. And then, which means we need to make sure that we have the prevention and awareness programs in schools. Like in SANCA, we do have a peer education program whereby we involve young people to be able to educate their peers on the dangers of substances, so that they can be able to say no to drugs, and then they can be able to even change their lifestyle if they've already started experimenting in using substances.
Clara, very quickly, the Amendment of Drug and Drug Trafficking Act states that nyaope is an illegal substance. It's a welcome development. How does it help your organization in debunking some of the myths around nyaope?
The issue of nyaope is that most of the people, they will say that it includes rat poison and other stuff that is really unknown. The research it's still continuing. If people were using rat poison, people could have died a long time ago. But still, there are some chemicals that are being used that are causing a person to be addicted to that particular drug. So we wouldn't say that rat poison is the major drug that is there.
Very quickly, Clara, tell us about SANCA's footprint nationally, and how accessible are your services to people in remote rural areas right now?
Okay, SANCA, it's got about 29 centers all over the country. We've got about 9 inpatient treatment centers. We are making sure that each and every center in all the provinces. They have satellite offices in the areas that are not accessible. And we are also being funded by the Department of Social Development, that we make sure that we are going to capacitate on this financial year 2014-2015 a community-based organization in the remote rural areas to be able to educate them about the issues of drugs, and also those who are establishing their own NGOs can be can be capacitated in making sure that they have their own NGOs up and running to be able to assist people who are using substances.
Sankas Clara Monokotla, thank you for your time on the PM News Desk. Moving on to other news.